Let's turn to Dr. Georges Benjamin. He's the Executive Director of the American Public Health Association. Dr. Benjamin, thanks for being on the program with us. Let me just get your take on President-elect Biden's plan to speed up vaccinations. How realistic is it to have this goal of 100 million vaccinations in the first 100 days?
Well, thank you very much for having me. We know that it's going to be a good plan. The important part about it is that we actually have a plan now, and we think we can get to that 100 million doses with some work. He's going to first secure the supply line of vaccines by creating a system of reliable, constant vaccine. And then he's going to work on the infrastructure in terms of staffing, programming, making sure that we have the systems in place to get that last mile, which means getting actually vaccine in the arms of the American people.
And how important is what he wants to do with the masks, making sure everyone wears a mask the first 100 days of his presidency?
Well, your show just pointed out the fact that we have this raging epidemic around the country, and we know that you get this disease from other people. And the way you control that is wearing a mask, washing your hands, and keeping your distance. So his leadership on wearing a mask will be very important as part of us breaking the cycle of infection.
There's been so much concern and confusion, doctor, about this new variant, I should say variants of COVID-19, the latest one in Brazil. We've also seen 2 separate strains in the UK and South Africa. How widespread is this here in the United States? How concerned should we be?
Well, we're seeing this in the United States because we're actually now looking. It's not uncommon for these viruses to change all the time. This is expected. And the good news is that best evidence is that the vaccine that we're creating right now will continue to be effective against this particular virus. But we do have to be on guard. We do have to check it. And it's been important for the vaccine companies to also to be looking at whether or not they need to remodel the vaccine in the years to come.
And finally, doctor, the deaths here in the United States are just staggering. 43,000 deaths just in the first 2 weeks of January, the highest ever. And with the slow vaccinations rollout, are things going to get a lot worse before they get better?
Things are going to get a lot worse because what we're seeing now is the manifestation of the Thanksgiving and then the Christmas and then the New Year's travel. And that's the reason we're seeing these outbreaks. The vaccine was not going to affect those outbreaks, but they will protect us in the future. But the way we need to continue to deal with this thing, wear a mask, wash your hands, keep your distance, and get your vaccine when you're eligible to get it.
And even when you do get your 2 doses of vaccines, you should still continue to practice social distancing and still wear a mask.
Absolutely. We know that this vaccine does protect you from getting severe disease, but it doesn't yet know, we don't yet know whether or not it protects you from spreading the disease. So that's very important.